Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guest is nurse practitioner Mia Hartman, and she's here today to talk about the latest developments in her business. Welcome to the show, Mia.
Thank you so much for having me back.
Yeah, you've been on here before. And
yes.
It was great having you then because you're a natural. And by the way, we were kind of joking here. I never wear green. I put on a green shirt today, and she shows up. And
matching.
Yeah, it's just
Kismet.
It was just total by chance.
Oh,
so what's going on with your business?
So Optimal You is launched full-time now. So it is a hybrid clinic in that I'm able to reach further out than even just Vermont. I'm in multiple states now through the virtual services.
Really?
And then also have some in-person opportunity in office hours here right in Newport out of the Luxe Beauty Studio, which is just the perfect setup and place to be.
Now, where is that?
So it's right on Route 5, right across from Agway. They just remodeled that building. So if you haven't checked it out, you absolutely should. It's like you can get your hair done. If you're into tanning, you can do that. Pedicures, manicures, a wonderful esthetician out of there that does lots of other services. And now I'm able to add the wellness side of things with hormone optimization, weight loss, and also help you stay looking your best with the aesthetics services.
What else do you offer? Are you do you do like traditional medicine? Are you like a primary care person or?
So my training as a family nurse practitioner really goes through the entire lifespan in terms of my medical knowledge and training. So, but I've created Optimal You to blend all of the best worlds that I have a passion in. I'm really passionate about, foundational, functional type medicine and, natural supplementing, root cause analysis. I do believe there is a place for medications, and that oftentimes when you are taking the best of all, you just get the optimal results, which is how Optimal You really came to be.
So somebody can have you just as their primary person?
So I don't do primary care. I am all focused on wellness. Okay. So, if you have certain disease processes that you're already working with the primary care provider and you're on lots of different medications and things, but you have a desire for wellness and to look at what you can do to support your health and come off of different medications or help to support and reverse disease processes, that's really where I come into play. So it's all about understanding and getting a good baseline of where your health is at. So we utilize lab results to do that, and we'll come in and we'll really assess. I'll see what your symptoms are, what things you're already struggling with, and then we'll come up with the plan of what's possible for you to live with longevity and vitality and all of those types of things.
So do you work with other doctors though? Like if you have a patient who has other needs, you collaborate?
Yeah, so I'm always open to collaborating. So especially with thyroid patients, for example, those that are already on different types of thyroid medications, I'll work collaboratively. So give suggestions and recommendations. And oftentimes, their provider will be like, yes, please, you handle this portion of it, but we're working in collaboration to make sure that everybody has, really good eyes and management and follow-up and care in that way. And then I have a large, provider support internationally with different groups that I'm a part of, functional medicine-wise and hormone-wise and things like that. While I'm typically the face that you see, the support is pretty vast.
Okay. You know that you mentioned one thing, the weight loss. You know, I used to laugh about weight loss. When you're younger,
Yeah.
I could think about losing weight, and I could lose 5 pounds.
As a man, of course.
And now, after, as you know, I lost my wife to cancer, and during that time, I really fell apart, as in physically, because I was a caregiver, and then I gained weight, and then I went back to lose weight. So what the heck? And so now now I think I've lost 12 pounds, but it's taken trail running, mountain climbing, eating spectacular. But back in my younger days, if I did the exact same thing I'm doing now, I would probably be down 50. Well, I wouldn't want to lose 50 pounds.
Right.
But the thing is, boy, does age really do that to you?
It does. So when we are aging, as we increase in the number of age, there's other really important parts of our vitality that start to decline. Hormones. Our hormones start to really decrease in their levels, in our blood levels. And oftentimes that's playing a huge role in things that used to be easy to do, now take a lot more time, or for some, just almost impossible to break through that barrier. So, for men specifically, testosterone is a big, important hormone that can play a role in your body composition as you age. So that may be one of those reasons that, back in your 20s, 30s, you had pretty high levels of the testosterone if you're lucky. There are some, especially in our country now with, the different toxins and endocrine disruptors that really impact our hormone and our ability to make them. So I'm seeing younger and younger individuals with low levels of testosterone and things like that. But, if they are at a good level, then your body composition is just easier to maintain and to correct versus obviously as you age.
On the positive side, I actually feel super.
Good.
I'm on a little bit of blood pressure medicine, and it's just, even that is starting to come in the line. So, but no, I had to mention the weight part, because I used to always tell, like, why is there so much of a hassle at losing weight? And it's like, oh, that's why.
Yeah.
So
there's a lot that goes into your ability to lose weight or not lose weight. And a lot of times it's easy to kind of just focus on the biggest symptom that's bothering you. But one of the things that is kind of unique in how I operate and practice in some of my protocols is looking at all of the things that could be contributing to the ability to lose weight or the inability to lose weight, or why you're gaining weight even though you're eating well and you're running and you're doing all the things. So your thyroid function is a big part of that. The thyroid actually is a big part of your hormone balance, because those with, for example, those with unopposed high estrogen that has high waist, oftentimes it's impacting their thyroid function, or their thyroid function, or vice versa type of thing. Inflammatory processes are really, really impactful in terms of negatively impactful on your health. They're the cause for most disease-related illnesses and things like that. So, talking about inflammation and cellular health, that's where all of our health lies. If our cells are not able to communicate because of the inflammatory processes that break the receptors, and it's like a game of telephone with kindergartners. If you have no receptor sites that are working properly, by the time you get to the end of that line with the kindergartners, the message is different.
Right.
And so that I see happens quite often. So when we're correcting those foundational issues, just correcting that, a healthy body is a healthy body. Healthy bodies are typically at a healthy weight as well.
Right.
So it's really more about the weight or the health, and oftentimes some of those symptoms that we're struggling with just automatically start to correct anyways.
Right. So what else do you do? Do you do like Botox and that kind of stuff?
Yes, I do.
Yes,
I do. So I believe in whole wellness. And I think that when you are feeling your best and looking your best, that they work very hand in hand. So sometimes it's, you're starting to feel better, your hormones are more balanced, you're losing weight, and you're kind of like, you know what, I really want to look at, what I can do to really support my skin and my, the appearance. And sometimes it's the other way. You're kind of like, oh, I want to support my skin and my appearance. And then you're starting to just kind of look better and feel better. And you're like, well, I want to be more careful about what I'm putting inside of my body as well. And I want to look at other things. So I think that having both of those aspects can really help to reach everybody at where they are, at the point that they're at.
I was actually totally oblivious, really, to that part of, I don't know if you'd call it health, but I am now involved within a culture that is very much into skin, as in the Philippines. In the Philippines, and they have they have Botox clinics and such, like everywhere. And so I hadn't really. I didn't really even think about that as part of. So, do you consider that health care, or what do you call it?
So, Botox in specific is a brand, obviously. So, kind of like we say, Kleenex, Tylenol. These are all big brands that did a great job of marketing in the U.S. And so we know it by those brands.
Really? Okay.
But the actual active ingredient, if you will, like in Tylenol, acetaminophen, for example, is the botulinum toxin. There's different versions of that toxin, but basically there are medical uses for that toxin. So for those that struggle with chronic migraines, doing some injections, because how it works is it relaxes the muscle essentially, so it reduces those dynamic wrinkles, but it also helps reduce tension. So those that have chronic migraines, or if you have really TMJ pain, which can be debilitating for many, or those that have a lot of stress and they're grinding teeth, so then they're having dental issues, I can use those types of medication to prevent them from being able to clench as hard. So they have less pain, so they have better health. They have less pain, so they're less irritable, and they can do more and be able to function better. That's kind of like the medical side of things. And then of course, I believe that if you look better, you do better, or when you feel good about how you're looking, that you just, it kind of automatically goes hand in hand with caring about other parts of your life as well.
Right. It does make sense. And so you must be is that offered much around here, or are you like one of the few?
I think that there will be probably more and more providers and practitioners that will choose to start offering these types of services, because it's needed, and there's a lot of interest in this area. I know I'm one of the more experienced providers in doing these types of injections, because of course we have lots of training, and there's lots of areas where a provider can get its experience, but you definitely want to make sure that whoever is administering these injections, that's not without its risk. So you want to be very careful about that as well.
Right. So what more do you, on the beauty end of things, do you offer any more?
Yes, so as I mentioned, out of the Luxe Beauty Studio, there's a wonderful esthetician there that offers some other facial treatments and things, and very soon we'll be able to be offering like microneedling, lots of different treatments to help your natural body produce. So I am one that really appreciates the natural beauty and being able to just really enhance and accentuate what you already have, and not necessarily change the shape and face. I think that's a lot of the misconception in certain areas, is that, oh, if you get things like Botox or filler, then you're going to look like the Hollywood, crazy big lip, face unrecognizable. That's really out of the norm, and you can really do a lot of these different types of treatments, even using things like filler, especially in weight loss patients that have lost a considerable amount of weight. You lose some of that volume and it can make you look older than you are. So treatments that help to stimulate the collagen, and that also is internal. So taking things like your vitamin A and collagen and biotin and even things like glutathione. There's just a lot of other things that you can do to support from the inside that actually really starts and helps your glow on the outside.
So can you make me look like Brad Pitt or something?
Might take a little bit of effort, but I can make you look like the best version of Scott that you ever did see. I can promise that much.
So where do you want to go now?
So a lot of times I like to just revisit the whole process of, what you can expect with services that I offer. Of course, I'm not, like we said, I'm not doing primary care, but if someone's interested in just getting a baseline, if that's all they want to see is, okay, how healthy am I today, or are there little things that I can include? I always check for certain deficiencies that are very common in our area, but that impact us greatly. So things like vitamin D, I will draw labs on a lot of individuals, be like, well, I work outside, or I do this and that and the other, and I'm sure I have ample levels because of the sun. Vermont sun is not really that interested in giving us that much power for the vitamin D. And so a lot of us are walking around with vitamin D deficiency, which is impacting everything. It's vitamin D, we call it a vitamin, it's actually a hormone, really helps to increase our neurotransmitters, which carry really important messages for hormone balance. So even just supplementing your vitamin D levels could help you to feel better and decrease things like anxiety and depression and help with your weight loss efforts. B levels are another example of things that are often deficient and impacting in many ways outside of just, your metabolism, but it's really important. It's literally fueling the fuel house of your cell. So these are really impactful to the bottom line, which is your overall health. So the panel of labs, I've made it so that it's very affordable to get large amounts of labs. Sometimes going through insurance, they choose for whatever reason not to cover, and people can be stuck with, thousands of dollars worth of bills for labs that, through my practice, you're able to get for a very reasonable cost, and includes me actually going through and explaining. I'm really passionate about you understanding where you're at with your health and understanding and using that knowledge to really feel empowered that not only do you know where you are with your health, you know what you can do, what's in your wheelhouse to support feeling your absolute best. And this oftentimes has nothing to do with medication.
Right. Do you take insurance?
So that's a great question. So Optimal You doesn't process insurance paperwork, is basically what I'll say about that. But I do provide you with what's called like a super bill. So you can present it to your insurance. And for those that have like health savings account, often it's a breeze. It's a walk in the park. You present them the bill that I essentially give you, which has like your diagnosis codes and things like that, and you're able to get reimbursed yourself. Others can go directly through their other insurances, but long story short is that I don't process the paperwork, but I do provide you with enough that there is an opportunity to get reimbursed. So it's a hybrid. I'm big into hybrids, apparently.
Do you think, this is maybe just too vague or too vast maybe, do you think our culture focuses more on pills versus actually getting to the root causes?
So I think really I think that there's a lot of providers, a lot of really amazing providers that have a desire to do more digging and to really help you be healthy, because right now our model is sick care, not health care.
Right.
You kind of go when you have to, and we're kind of looking for a cause or something to correlate for a reason to get another medication. And a lot of our guidelines and protocols are really like finding what it is so that we can prescribe. It's looking for to prescribe. So I think that it's more of the way that we are taught in medicine, but then a lot of us will go and do additional research and, you know, really expand on our knowledge to be able to provide better services and more in-depth healthcare. However, with how how it's set up, they don't have the time.
Right.
So we gotta prioritize, and it's like, okay, well, I've got 5 to 10 minutes and I've got 30 patients I gotta see today, and I've got a chart on all of these, and I have to satisfy insurance. So what I'm gonna do is find what I know insurance will cover, which is typically, hey, this is a blood level or this is a symptom, and I have a pill for that. And that's why it ends up that way. And I think that if we were in a culture that we had more time to be able to spend with our clients and our patients, that it may be a little bit different, but I think it's kind of just by default because there's simply not enough time to do more.
I once interviewed a fellow that I knew quite well, Dr. Frank Fioramonti. Dr. Fioramonti began his healthcare career back when he would sometimes, his office was on Main Street in Derby in the big beautiful house that partially burned back a couple years ago, and it's been totally redone. And sometimes this is how far back he went, is he would sometimes accept a bushel of potatoes for pay, because he'd go out. So he'd go out into the countryside. Sometimes they'd have to pick up him in a horse and buggy at a certain point and bring him to the house. And he delivered babies, he did everything. Well, in the I want to believe it was 1960s, he decided, or early 70s, he decided to get rid of his practice and go to work for North Country. Nothing against North Country, but he was in that kind of, it was at a period of time where healthcare was changing over from healthcare to a
sick care model.
And he told me, he said he went from practicing medicine to practicing cookie cutter medicine, he called it, where you were expected to go in, a person came in and you just followed this model. And he said next thing he knew, he was also being kind of reprimanded for not
following, exactly.
for not giving enough tests, as in like,
diagnostics and things like
diagnostics.
that,
And he says, because I didn't need to. He said,
Right.
sometimes you need to. But he said, a lot of times, if you have time to talk to the person.
You can find out a lot by speaking with somebody, and taking the time, which is why I am so, I'm grateful and thankful for being able to have the opportunity to have the time, and it's not, I tell my clients I utilize blood work and I get the testing so that we have good baseline, because then we can really, definitively say this is the treatment we did and look at the difference that we can see, because it's really important to have good baselines to see how well our treatment plans are working and what we can tweak from there. But I'm never treating a lab. We get our lab results and, oftentimes I'll hear like, well, I got my labs and the doc says everything's normal. Oh, that is like a please come and let me see them type of conversation that I like to have, because we get our reference ranges from testing millions of people, right? And these are kind of the averages that have occurred from that testing. Those are the results. However, we're testing people that are not Olympians. These are not prime examples of health or even optimized health. This is just what it is type of a deal. So oftentimes, even though your labs may fall within the reference range, I call it a reference range, that doesn't necessarily mean we've gotten to where we are or where we need to be optimized. So I always tell my clients, I treat you, not your labs.
Right.
So if this looks like, even if I have kind of an optimal goal, with some of these lab levels, if we get to a place and you are feeling like a rock star and we're not technically within this optimal range, oh well, this is your optimal range. Right. You understand? And if we're in an optimal range, but we have some tweaks, oh, well, we have some tweaks to do. So that's kind of like my, because I'm so passionate about people truly feeling healthy and living their most, vigorous, vitality, and their most vigorous vitality. I, take the time to continue tweaking and continuing to get to where you desire to be. And that's different for each person. So, personal preferences and, culture and ideals, that is a big part of our conversations and our consults and things, because especially in terms of weight loss, what you do to lose weight is what you must do to keep it off. So my weight loss program, I really prefer to call it a weight release program, because we're not losing it. We're not trying to find it again. We're releasing it. It's gone, so it's a definitive program. Once it's gone, it's gone. It's developing that plan that the client feels they can do forever. It no longer becomes a thought process. It becomes the way of life. And, through this program, people are healing those food wounds and learning how to look at food differently in a way that is fueling the body that they're learning and now love. So, we're working mentally with different, even food eating disorders sometimes. So it's all encompassing, and I'm always looking at hormones. So you're never just getting I only am looking at my thyroid. I want to see what my TSH is. That's just not that type of clinic. This is not that type of practice. If you're really, if you're having symptoms, a lot of times the symptoms that you may be having, you may equate with something else, maybe life stressors, which of course stress and cortisol levels and things really can impact your overall health as well. Right. But, if you're having, just even depressive or anxiety or irritability, or you're having just chronic fatigue, lack of interest in things that you used to, aches and pains, back pain, all of the kind of, I'm just kind of getting older symptoms. Yes, but also there's probably something we could do to make you feel better.
Well, I'm a very intuitive person. I don't know if it's just who I am or my psychology degree, but yeah. Even the whole thing of grief and loss with me, even like, well, my late wife, Penny, even the cancer doctor in Burlington used to always be amazed. Must be both of us were intuitive. She, before the tests were even done, the MRI, she could pretty much predict where the cancer was, because she never was given a chance. She didn't. This was cancer that weren't going to be cured, but she was able to. She was so in touch with her body. She said, "All right, doc, the cancer has gotten in my lungs," and she was. But with me, during the whole grief process, people think grief mental. Well, it also takes on physical forms, and because with me, I've just written reams and reams and reams, and I actually think I've helped people through it. And but yeah, mental health issues, or grief, that can have a profound impact on your body.
There's no part of our lives and things that we experience that doesn't impact us in some way, whether that's positive or negative. But I think that if, we're aware that we can't really control every aspect, every toxin, every environmental change, but we can do our best to support the things that we know, like making sure at a minimum our deficiencies are supported and supplemented, and that we're doing our best to fuel our bodies with things that will help with our end goal, and things of that nature. I think that's kind of the best long-term solution to dealing with what we have no control over.
Okay, we only have a couple more minutes left. How can people reach you?
Yes, thank you for asking. So you can go to my website, www.miahartman.com. You can reach out via my telephone number via text or call at 802-323-2632. Or you can email me at nphartman.22@gmail.com. Either of those routes can get you contact with me. If you are interested in doing a consultation, essentially the lab draw is the first part of that process, and then you're able to book our consult at least a week out so that we have time for those labs to result, because it's a big part of the conversation. And then we can go from there and develop a plan of action that works well for you.
Okay, well, thank you for coming on.
Thank you again.
You're always a natural at this.
You make it easy. You make me feel very at ease, so
Yeah.
I'm lucky.
Okay, well, thank you.
Thank you, Scott.
And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.